female gynecological points. As per the master tongue, we have many points. They are working for the all female gynecological problems like Phuke 11.24, which we were discussing in our last session. This Phuke point, one of the best point given by Master Tung, which is useful for all the female gynecological problems. So yesterday we have seen if we look at the palm, so in the palm we have multiple lines. We are telling them A, B, C, D in that way. So in the line F, so F line can be seen from here. So we look the palm from this side. This is the central line or G line. And we know A, B, C, D, A, B, C, D, E, F, G, H, I. So before G, what coming F? So this is the F line. And we can see I am making the F line just adjacent to the bone. This is the F line. In this F line, we have all the female points. So this is the joint. This is also knuckle or joint. We are drawing F line adjacent to the bone. So this is the joint. This is the joint. And adjacent to the bone, we are drawing a line. In this line, we are searching 2 points at equal distance. And we are inserting the needle perpendicular. So these are the 11.24 or Phuke. This is one of the best points in master tongue. If you see all the systems, like whatever other system of the acupuncture, means we are having many good points, but we cannot compare with this 11.24. This is the best point for all the female gynecological problems. So we are putting this point on one hand. So wherever we are putting the 11.24, other side, we are putting the 11.06. This is the couple point. So this is the main point and this is the couple point. But just we have to remember one thing. Do not put both the point in one hand only. If you are putting both the hand in both the point in single hand, then there will not be energy circuit will not be created, because one point belong to the yin and this point belong to the yang. So we are making a wonderful circuit. So in the one hand we are putting yin 11.24, in the other hand we are putting 11.06. If we are putting only 11.24, this point alone also working. If we are putting 11.06 alone, this point alone also working. But when we put both the points together, so effect becoming multiple times more. So shortly we will see the location of 11.06 as well. So right now we are thinking about the 11.24 only. These are the 2 points together called 11.24. Means 11.24 means this is the 2 point unit which is called 11.24, or we tell it Fouquet. Fouquet is the very famous term in the master tongue. If we ask you, tell the master tongue gynecological point, so your answer will be Fouquet. This point has been, this point is very famous as a gynecology point. If you insert the Fouquet or 11.24 point, this point is very good for all the uterine problem. This point is very good for the uterine tumor, tumor in the uterus, any infection in the uterus, uteritis, pain in the uterus, uterodynia, any pain, and because of reproductive problem, if any issue like abdominal pain, this is connected with the menses or uterus. If infertility, if blocked ovary means blocked fallopian tube, if polycystic ovary or PCOS, if endometriosis, this is the problem of the uterus, excessive menstruation, lesser bleeding or menstruation during the period, colic pain during the menses, all the problem which is related with the uterus can be treated with the help of this. If there is a breast nodule or any node in the breast, so we are treating with the help of 11.24. If we know if this is the cyst in the right breast, so we are using 11.24 in the left side. If cyst in the right ovary, then we are using 11.24 in the left side. So if we know the problem side, then we are using this point opposite side. But if we don't know, because some patient coming to us telling I have polycystic ovary, so many patient doesn't know that whether it is in the right side or left side. So on one sitting, first sitting, we can add 11.24 on right side, and second sittings we can use on the left side. So we can choose anything, whatever we like. After learning the balance method of Dr. Tan, which is already going on, then I will explain you more scientifically why this Fouquet is so much capable and able to work on these multiple problems. So let's wait for 2 more days. Then you will understand automatically. Just right now, I want to tell you one thing when we talk about the thumb. So when we talk about the thumb has been considered under the criteria of lung meridian. So whenever we are stimulating the Foucault point, we are working on the lung meridian. It means lung meridian having some capability. Lung meridian having some connectivity with the reproductive part. So what is that connectivity? We will learn in the train balance method. So because of that connectivity between lung and uterus, if we treat the lung, it is working on the uterus. If we treat the lung, it is working on the chest cavity, on the breast. If we treat the lung, it is working on the mucous membrane of the vagina. So vaginitis, cervicitis, vaginal discharge, leukorrhea, white discharge, red discharge, it is working on all the problems. So 11.24 is the point which is working on the more problem which I told you right now. The list may be very longer. If this problem is connected with the uterus and reproductive hormones, so we can apply the Foucault point. Foucault point is very much connected with the reproductive part. Foucault point is connected with our master brain. And in the brain only, brain is secreting the hormone GTH, gonadotrophic hormones, which is the control of sex hormones. So Foucault point having very great approach. It is working directly on the central nervous system, having so much power to rectify the problem of reproductive part from the central nervous system level. So if we know the side of the problem, then we are using Foucault point on the opposite side. Otherwise, we can change the side one day on the right side, second day on the left side. And strictly, we don't use bilateral. We are not using this point both sides together. No, not at all. Not allowed. If you use, so don't worry, something wrong will not happen. But there will no desired effect. The point will cancel each other. So in this way, if we want to work more efficiently, then we have to add the Foucault point. Now, if we want to enhance the effectiveness of Foucault point, then other side we will add 11.06. 11.06 point. If Foucault point we are adding in the right hand, then 11.06 we will put in the left hand. So let's discuss about the 11.06. So look at the palm. Now we are reaching to the ring finger. Ring finger is very sensitive finger, which is connected with the reproductive part. This connectivity can be understood because in the ring finger we are having one meridian The name of that meridian is triple Barmer or triple Barmer meridian or triple heater meridian. Triple Barmer meridian is the meridian who is responsible for circulation. This time 9 to 11, right now 9 to 11 p.m. This time belong to the triple Barmer meridian. As per the acupuncture organ clock, in the night 9 to 11 meridian, this is the time of triple Barmer, and triple Barmer supply circulation or energy to each and every meridian between 9 to 11. Triple Barmer carry the energies from the root, that is the kidney. Triple Barmer carry the energy from the Ming Mang, this point between both the kidney. Triple Barmer carry the energy from the governing vessel 4, where we have stored kidney yang. Triple Barmer take the energy from the kidney yang, and then yang energy distributed all around in each and every meridian during 9 to 11 p.m. in the night. So right now this work is going on. If we are very much relaxed, very calm, then this work will keep on going very efficiently. So triple Barmer is sending the energy of kidney yang. Kidney yang will reach to the heart, then heart start functioning, heart start beating. Kidney yang reaching to the lungs, then lungs start inhaling and exhaling. So the triple Barmer is responsible to supply the energy to each and every meridian. Because of that energy only, each and every organ is working. What will happen if triple Barmer is not sending the energy? All the organs stop working. So that working energy is coming with the help of triple Barmer. That is called kidney yang. That is stored in the Ming Mang. So now, if we ignite some point in the ring finger, they are working on the kidney. They are working on our original chi or lifting the kidney yang. So here we have 1 point, 11.06. When we are stimulating the 11.06, we are working on the kidney. Because inside of the triple Barmer, inside of the triple Barmer, the energy flowing, that is kidney yang. So ultimately, whenever we ignite the points in the ring finger with the thought of triple Barmer, but indirectly we are working on the kidney yang, which is the sexual energies. If you want to treat the infertility, erectile dysfunction, then you should treat kidney yang. And how can we treat the kidney yang? With the help of triple Barmer. So triple Barmer will treat the kidney yang, so capable to treat the infertility, male and female reproductive issues, all the issues which we have already discussed right now. So now we will search the E line in the triple Barmer E line. So let's start from the line A. So one by one we will search where is the E line in the ring finger. So first E line A line is this side, C line in the center, in between we have B line. So this is the line A, B and C. Then this is the line D, then this is the line on the corner E, on the junction of yin and yang. So finally we got the E line. E line on the sides toward the small finger side. So let's turn the finger a little bit. So if we turn the finger like that, so we can see this is the yin yang junction, black and white skin junction. On the side, this is the E line, and we have three joint. This is joint, and this is the joint. This is the upper phalanges. This is the upper phalanges. This is the middle phalanges. This is the lower phalanges. Now forget upper and lower. Just remember middle phalanges. So in the middle phalanges, in the E line, just middle point, that is the 11.06. So once more, we will draw E line, making the all three joints, forgetting upper and lower joint. In the middle joint, the center point is 11.06. The name of this point is 11.06, or other name is return to nest. This is the other name of this point, return to nest. This is also very effective for all the female and male. This point can be used for male, female both in the reproductive issues. So now I already told you, if 11.24 or Fouquet we are using in the right side, then 11.06 point we will use in the left side. So suppose one patient coming to you with a complaint of right ovarian cyst. Then this is the right side, this is the left side. Then what you will do? You will use the Fouquet point of the left side, Fouquet, or 11.24 on the left side, because this problem is the right side. And 11.06 point will come in the right side. So what I want to tell you, 11.06 point always will be on the same side of the problem. If someone is suffering with the right ovarian cyst, 11.06 will be in the right side. Right breast cyst, it will be in the right side. So 11.06 point automatically will fall on the same side. So in the male, we are using only 11.06. We are not using 11.24 in the male. So when we are using the 11.06 in the male, we are using same side. If we know, if we don't know, then we will one day we will choose the one side. In the next sitting, we will choose the another side. Let's see here again. So we can look this hand. Now we want to see the 11.06 or return to nest. So I already told you this in the ring finger. So we can see this is the ring finger. And this is the line E, the junction of yin and yang. And these are two joint. So our point will be in the center here. This is the point. This is 11.06. So in this way, this point become very much effective for the treatment of all the male and female reproductive issues. For example, this 11.06 or return to nest, which is in the ring finger on the line E. In the small little. So in the line E, so this is the point 11.06. What is the indication? We are using this point for all the problem like uterine disease, uterine infection, uterine tumor, uterine infection like uteritis, abnormal menstruation, so means irregular periods, more or less bleeding, like even dysmenorrhea, menorrhagia, all the condition which is connected with the bleeding, fallopian tube blockages, all the problem related with the vagina, vaginal swelling. So not only this, in the male also, if male is suffering with the prostatitis, any infection which is connected with the male reproductive organs, this 11.06 can be applied. So for the female, we are using combination 11.24 and 11.06. And for the male, we are using 11.06. These are the main points. We can also combine some other point in the body, which we will discuss later on during their term. We are doing little combination. Like if some female is suffering with the leukorrhea or white discharge, then we are doing little combination. Then we are using 11.24, 11.06 and Li4, large intestine 4. Where is Li4? You can see in this hand, in the large intestine 04. This is the point, Li4. We can see here in the dorsal hand, this very famous point. We have discussed the location of lingu and davae. We already discussed the location of lingu and davae. So let's see here once more. As per our previous discussion, we have seen this is the location of davae. Or 22.04. This is the location of lingu, 22.05. In between, this is the point. This is the Li4. Or we can find out this point in a different way. We know here is one muscle, very bigger muscle. The name of this muscle is interosseous muscle. And this point just in the center of this muscle. Let's see other image. This Li4 point is very famous in the acupuncture. If you look at the palm, here you can see between thumb and index finger in the center, this is the dorsal interosseous muscle. If you see in this muscle, the center point is Li4. If you unite thumb and index finger, then you will get elevation here. So this is the mountain. Means we can also tell. If you see the topmost prominence or mountain of this muscle, that is the Li4. So we are putting 11.24, 11.06 and Li4. This Li4 point can be used both sides. So 11.24 one side, like suppose right side. 11.06 suppose in the left side. And Li4 point can be used bilateral, both the sides. So in this way, we can treat the leukorrhea or white discharge with the help of these 3-point combination. Let's see one more example. If some female is suffering with the delay menstruation, delay period, delayed menstruation, or period, that time we are doing the combination of 11.24, 11.06 plus RAN 24. This RAN 24 point is very simple to locate. Look at the CV24. The CV24 point just below the lower lip on the depression. This point is very good for all the gynecological problems. Why? Because this CV meridian starts from the Mooladhara chakra, from the perineum. This CV meridian starts from the place between anus and genital part. Then it is coming up, up, up. So we can see this is the first point in the genital part. Then this CV meridian is crossing the pelvic cavity, coming up, crossing the umbilical region, going through the midpoint of the breast. Then it is coming up, 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 crossing the thyroid gland. We can see here, and ultimately ending under the lip, below the lip. So when we stimulate the CV24 point, so this is the mechanism of our body. If you stimulate the first point, it is activating the last point. So if we stimulate the CB24, it is stimulating the CB1. So this is the common protocol, the combination of 11.26, 11.06, and RAN24. Once another approach is this. If we divide this phase in three parts, this is the phase. We are dividing phase in three parts. So this is the upper body, this is the middle body, and this is the lower body or reproductive part. So whenever we are stimulating the point here, like RAN24, it is directly working on the reproductive part. So this is the very famous protocol 11.2406 and RAN24. It is working very nicely for the delay menstruation. So we can apply this protocol for the delay menstruation. Also, I told you yesterday, after the abortion, there is a pain sometime. So if you want to kill this pain, traditionally we are using spleen 6, which is giving relief for 10 to 15 minutes only. After that, pain coming back. But when we stimulate the 11.24 and 11.06 point, it is working at least for 5 hours. So this is a very great influence of these points. Also, when any male is suffering with the infection, with the problem of prostate gland or prostatitis, so what is happening? If there is an enlargement of prostate, so we understand this thing in the traditional acupuncture, that what is the meaning of enlargement. Traditional acupuncture explained about this. So let's see here. This is the balance energy. When we are having yang and yin, both force equal. Yang means energy and yin means material or weight or volume. So what happened? If there is an attack of cold, if there is an attack of cold, or if someone is taking cold food, or someone is living in the cold weather, or someone is having consumed the kidney chi, kidney essence, so body going in the cold mode. So this is killing the heat of the body or yang of the body. If someone is doing excessive sexual discharge, it also decreasing the hotness of the body, because we are losing our jing, which is creating proper circulation and heat in the body. So finally, what I want to tell you, because of any reason, if cold, evil, cold is attacking on the body, then what is happening? This is decreasing the body heat. So earlier, this is the yang, this is the yin. Yang means heat, yin means cooling energy of the body. So now your yang is getting decreased. So new, this is the yang, but yin is normal like earlier. So because of attack of cold evil, now yang is reduced. So we can see here, comparatively volume is high now. So volume, material, weight is high. So this yang deficiency will create the more volume, more weight or enlargement. So this incidence will create the prostate enlargement. So that's why in the acupuncture we are telling kidney, yang deficiency. That is the diagnosis. Or we can tell here just yang deficiency in the male reproductive areas. So that will create the prostate enlargement. And we are having one point that is 11.06. That is in the ring finger. Ring finger is connected with the triple Borman. Triple Borman meridian is supplying the yang energy. Triple Borman meridian, this is the taking the energy from the place which is the Ming Man, which is between the both kidney. So triple Borman meridian carry the energy, carry the Ming Man fire, carry the yang energy, and will supply to each and every part, including reproductive part. So as soon as we insert the 11.06, it is igniting the fire. It is again killing the cold. So it is reducing the enlargement. So 11.06 is the best point for prostate enlargement, prostatitis, and 11.06 is very good point for improving the kidney yang only, giving you sexual power. If kidney yang is poor, then it will create erectile dysfunction. So in this way, if we talk about the male, 11.06, one of the best choice for the male, which is creating the yang chi in the body. So we can stimulate this point without any problem. 11.06. So let's, okay, I will try to demonstrate one. So you can see my hand and you can see my ring finger. You can see my ring finger. Now you can see the line E. If I draw the line E, so this is the line E. You can see the line E on the junction of yin and yang. So whenever we want to insert the needle, we are not going in that way. We are not going in that way. This is the wrong way. Our point is right, but this approach is wrong. We are doing the 45-degree angle here. Then we inserting the needle and leaving the needle, it will become automatically like this. So look at here now. So I am keeping needle like this. So I am keeping needle like this. You can see 45-degree horizontal. If you can see, inserting the needle in that way. If I do my hands like this now, it is looking like more horizontal. You can see the hand. It is looking like more horizontal. And this needle in the line of E line. So this is the couple point for the female and independent point for the male. 11.06. This point is very effective for improving the kidney yang, kidney energy, enthusiasm, virility. This point is very effective for keeping away all the reproductive problems in the male as well as in the female. So this is 11.06. Yes, definitely. So when Li4, 11.06 can be used with the Li4. So we can apply multiple approach. Mainly these points we are using for the reproductive problem. If you're asking for the prostate and urine problem for because of prostate, it is good point. But if you're asking only for the urine problem, the problem of the urinary bladder, definitely it will work, but we have more other point also. So now look at about the triple bar. 11.06 point is connected with the triple bar. And triple bar meridian improving the yang qi in the body. And yang qi is the basic energy. When yang qi go to the heart, then heart is functioning well. Yang qi go to the lung is functioning well. Go to the reproductive part, then reproductive part getting good energy. It is going in the spleen, then spleen is making the good food chi. So in that way, the 11.06 is a very great point. Without kidney yang, you cannot imagine the work of any organ in the body. All the organ will stop working if no kidney yang. So kidney yang is the basic fuel for all the organs. So this is the, when we want to insert the needle, 2 fan insertion is enough. So when we talk about the thumb width is 1 chun. And 1 chun is equal to 10 fan. So we can use only 2 fan. That is enough. So this is the completion of Fouquet and return to nest, or 11.24 and 11.06. Let's proceed now. Now we are going to discuss most important point. The name of these points is five tigers or 11.27. So the name of these point is five tiger or 11.27. So look at the thumb. Look at the thumb. In the thumb we have multiple lines. So let's see first A line. We know A line is here. The A line is here. So our five tiger point is just available on the A line. Five tiger point, mainly these tiger eating the UDF. The food of these tiger is UDF. What is UDF? UDF means undigested food. So as soon as you put this five tiger, they are eating the undigested food, which is creating the problem in the body. So they will eat the undigested food, then problem will be rectified. So we have five tigers. If we divide the body in five parts, 1, 2, 3, 4, and 5. So tiger 1 eating food from the upper part, tiger 2, then next, tiger 3, next, tiger 4, next, and tiger 5 next. So in that way, we have allotted the whole body to five tigers. If anything happened wrong in the upper body part, so we will put the first tiger. He will eat all undigested food, then upper part will be lighter. If anything happened wrong in the next, then we will tell the second tiger, go and eat undigested food and bring the lightness. So these function done by the tigers. So here, if we see the other image for more clarity, yeah, come see this image here. So look at the palm. In this palm, we can see this is the A line. A line is here. So this is the joint. Here is also joint. And in between, this is the A line. So we can see here, this is the joint, and this is the joint, and this is the A line. If we draw the 5 point at equal distance, first make a central point, then 2 point here and 2 point here. So 1, 2, 3, 4, and 5. These are called five tigers. Tiger 1 for fingers. Tiger 2 For hand, tiger 4 for feet, and tiger 5 for toes. And tiger third will work with both, means upper and lower. So if someone is having pain in the finger, especially if this is the pain of rheumatoid arthritis, because in the rheumatoid arthritis, in the chikungunya, there are lots of toxins deposited in the small joints. So just by putting the tiger 1, 2, within 5 to 7 minutes, you can see the changes. Tiger will eat all the undigested food from the finger. If someone is having pain in the toes, pain in the feet, so we can add the tiger 4 and 5. Never put all the 5 points together. You will see we will leave all the 5 tiger, they will eat all the undigested food. Then effectiveness will be lesser. Because body has to send lots of energy from top to bottom. So either you work on the upper part or lower part at a time. In the second sitting, you can work in the other part. So you can do something like if someone is having pain anywhere in the body, all over, then in the one sitting you can use tiger 1, 2, 3. In the second sitting you can use tiger 4, 5 or 3, 4, 5. In that way we can apply the point. So these 5 tiger points we are using most of the time for the patient suffering with rheumatoid arthritis, because in the rheumatoid arthritis we are having lots of undigested food deposited in the joints. And chikungunya, in the chikungunya also there are lots of toxin deposited in the joints. But not only this, even this is the osteoarthritis. If someone is having pain in the fingers because of osteoarthritis, we can use 5 tigers. So let's see other image for clear impression. So we can see the thumb here. Now we are going to the A line. So in this image, this is the joint, this is the joint, and here we can draw the A line, making the center point, then 2 point up and 2 point down. So this is the tiger 1, tiger 2, tiger 3, tiger 4, tiger 5. So we are telling them 5 tigers or 11.27. So we are telling 11.27, 1, 11.27, 2, 11.27, 3, 11.27, 4, 11.275. So this is the tiger 1, tiger 2, 3, 4, and 5. So tiger 1 especially working in the fingers, tiger 2 working in the hands, tiger 3 working in the upper part and lower part together. So we can apply for both. Tiger 4 for the feet and tiger 5 for the toes. This is the classification number 1. As per the classification number 2, tiger 1, 2, 3, 4, and 5. So this point is very useful for the gout, very useful for the gout. 1 minute. So these 5 tiger points are very useful for the patient suffering with the gout problem. And for any problem which is creating the undigested food in the top and the collection of the fluids and liquids. 5 feet. 5 feet की बात की. But remember one thing, if the patient is suffering with the pain in the right hand, we have to use the tiger on the left hand. We have to use this point opposite side. We are not using point on the same side. See, the A line will always be on the radial side. Like in the index finger, if we talk about the index finger, it is on the thumb side. But even we see in the thumb, it will be on the other side. It will not be toward the index finger side. So A line, which I shown you, A line, the 5 tiger points available on the A line. So we can use the tiger 1 for the pain in the fingers. And deposition of gouty nodules, deposition of the uric acid crystals, uric acid particles in the finger joints. Tiger 2 for pain in the hands or palm. Tiger 3 also we can use, because tiger 3 we are using for the edge junction. Then tiger 4 directly we are going to the feet, and tiger 5 for the toes. Now, if we divide our body in equal 5 parts, so tiger 1 we can use for the upper part, means head region. Tiger 2 we can use for the chest. Tiger 3 we can use for the abdomen. Tiger 4 we can use for the reproductive part, and tiger 5 we can use for the lower part. So in that way, we can divide whole body in equal 5 parts. But most of the time we are using these 5 tiger points for the pain in the finger and toes. Finger and toes. So if patient is coming, can you treat my pain in the finger, pain in the hands, pain in the wrist? So we are using tiger 1, 2, 3. Another patient asking you, can you treat my pain in the feet? Can you treat the pain in the toes? Then we are using tiger 3, 4, 5.